Trust India is a continuation of the missions to leper, which was started in 1874 by Wellesley Cosby Bailey in Ambala, India. So it is a 150-year-old organization which started in India. At present, we have 16 hospitals. As you would be aware, works in various domains like healthcare, community empowerment, sustainable livelihood, advocacy, research and training. The challenges that we face in India particularly is, as you would be aware, leprosy was declared eliminated in 2005. Post 2005, the potential donors have been waned off because they believe that the leprosy is on a decline. But as WHO figures state, even in 2019, India had 57% of new leprosy load, nearly 114,000 cases that were added in the year. So leprosy is still a problem, but the funding has gone down. The treatment cost has gone up. And as you would be aware, leprosy is treated free of cost in Leprosy Mission Hospitals. So all this is borne by the hospitals. HR cost has gone up. The staff attrition rate is there. We train new people, and then they, after some time, when they gain expertise, some of them they go. And this is one of the biggest challenges that we face. New regulations have come in. So when you talk about new regulations, new infrastructural requirements, new statutory compliances, which have to be met. And all this sometimes require funding where we face problems. Treatment of leprosy patients per se has become a little more challenging because they present with comorbidities sometimes. And even if there is funding for leprosy core disease as per se, but then these comorbidities like age-related illnesses, hypertension, diabetes, other illnesses, they have to be supported, and there is no funding for that. We in the hospitals, we believe we are a 150-year young organization. So we have a lot of enthusiasm among people who are already working. And there's an extensive training program that we have. We train each staff who enters the organization. There's an induction, there is an orientation for leprosy disease per se, and also about disability care and how to refer in case that they find patients with leprosy. The training is, there are training modules which are custom-made for the kind of personnel that we recruit. So every doctors, nurses, physiotherapists, even the cooks, the gardeners, they undergo some kind of training so that we can train them to recognize and to be able to help people affected by leprosy. Funding crunch has always been there, but because we have evolved our hospitals into community hospitals, that is, we've opened our doors to people who are beyond leprosy care, like people who would like to avail services like general medicine, dermatology, ophthalmology, and these are people who can pay. We have centers of excellence for ophthalmology and dermatology in our hospitals, which attract a lot of footfall, and from there we earn sufficient funds. We gather sufficient funds to be able to support our activities. Fundraising efforts are there, which we do, and those have been very fruitful also. In terms of success, treatment is something that we excel in, and that is evident from the TLM hospitals being referral centers for most of India, wherever we are present. So we are in the National Leprosy Eradication Program referral hospitals list. All of our hospitals are there. So if there is any requirement, they can refer the patients to us for treatment of ulcers, for reactions to neuritis, deformities, The most important thing that we do is we do early detection and treatment to prevent disability. And this is done through extensive reaching out into the community by way of health camps, community awareness programs, sessions that we hold even in schools, colleges, communities, and away from not just in leprosy affected areas, but also in places where they have no awareness about leprosy, because awareness is the key to the elimination of the disease. Where we reach out to the major hospitals and ask them if they have any difficult to diagnose cases or difficult to treat cases, and we take the onus of bringing them to our hospitals and treating them, so that that lag of them sending the patient and patient not reaching us and thereby causing more deformity or disability is reduced. We also train a lot of undergraduates and graduates from different colleges, nursing schools, physiotherapy colleges, and schools who come to our hospitals for trainings and orientations and awareness programs. We have plans of starting artificial living centers. We already have mobile physiotherapy and rehabilitation units which are there. We also specialize in podiatry. So podiatric clinics are there. We have a 3D printing setup in most of the hospitals, where aids and appliances can be printed and custom made and can be provided. Footwear is something that we excel in, and that there again we have computer aided fabrication and designing of footwear. This is in terms of what we have as treatment and rehabilitation. We have started thinking of reducing the duration of the MDT, so thereby increasing compliance and reducing the adverse effects of the medicine. This is one research that's going on. The other research is total contact cast designed for ulcer care, for foot ulcers, so that they can provide non-weight bearing surfaces so that the healing is earlier. We also do rifampicin resistance detection, and thereby if we find anyone with rifampicin resistance, they are put on second line treatment. Stigma still continues. Patients delay approaching us for treatment because they're scared of telling people that they have the disease. They're scared of approaching Leprosy Mission Hospitals, especially because there's the stigma attached to the hospital itself that if you go there, then you are a leprosy case. Sometimes it's not very comfortable coming to a Leprosy Mission hospital. We converted our hospitals into community hospitals in 2008. Common entrance, and we have an OPD which is integrated with leprosy and non-leprosy cases. And slowly the people coming to the Leprosy Mission hospitals have understood and accepted that these are fellow people and there is nothing to be scared of. So we run a very good integrated program where we do not discriminate between leprosy and non-leprosy when they reach the hospitals, whether leprosy or non-leprosy. So that's how we've overcome the stigma that is attached, at least at our level. We all work with the district leprosy teams. Each hospital is attached to the district leprosy team, and the district leprosy team reports the state leprosy and state to the national level, which is the central leprosy division. So it is a system where we are working with them for the elimination of leprosy. So they provide us with medicines, that is the MDT, and we make sure that the MDT is utilized efficiently. We do most of the reporting, and then when we do the reporting, we have contact screenings, which sometimes is not possible with us, but is possible by the district leprosy team or the state leprosy team, so that we have a good information exchange between the government and us, which helps in reducing the defaulters and also helps in making patients aware that even their family members have to be screened and then treatment instituted as early as possible. The Leprosy Mission Hospitals in India are striving for excellence. So we have hospitals who have been accredited by the National Board of Hospitals. So we have 2 hospitals which have been accredited by NABH and 1 hospital which has been accredited for the laboratory that it runs. Accreditation is something that can be only achieved after you've already complied to the registration laws. It is a mark of excellence that is there. So that is something that TLM hospitals have achieved.